Hello, everybody, and I hope you're having a great day today. We are talking all about men's health awareness, and I have two doctors with me. Thank you so much for joining us.
You're welcome.
And I have Dr. Robert Lay here first, a urologist at Saline Health System. And I'm going to try your name on first try, Dr. Josiah Onyenekwe.
Yes, that's right.
Better known as Dr. O, which is much easier to say. Family practice doctor here at Saline Health System. Thank you both for being here.
Well, you're welcome. Thank you for inviting us.
Absolutely. So men's health, it can be a little bit tough to talk about sometimes. I'm married, have a husband, and sometimes it's just harder to get men to take care of themselves. So we are here today to share about ways that you need to take care of yourself and things to kind of really look out for. So Dr. O, I'm going to start with you. What do you see men most for?
Most of the time it's just general health. They're trying to take care of, a lot of times they come in for dysfunction, sometimes they come in for BPH, and other than that, it's just regular checkup to make sure they don't have the comorbidities of hypertension, diabetes, anything dealing with the thyroid, which is not really common, but mostly hypertension, diabetes is the biggest things that they really come in for. And obesity or weight is another thing that they come in for, just to make sure that they help. Because men don't like coming into the clinic.
They really don't. It can be like pulling teeth sometimes.
Yes.
So, and as a urologist, Dr. Lay, what do you most commonly see?
Well, Dr. Onyenekwe will send me the patients with the enlarged prostates. That's what BPH is. It stands for benign prostatic hyperplasia. And now, the distinguishing thing is I need to make sure that they don't have prostate cancer also. Often he sends me patients with an elevated blood test called a PSA. And if that's elevated, we may have to biopsy the prostate in order to be sure that they don't have cancer. Whether or not they have cancer, that's a whole separate issue, but if they don't have cancer, there are treatments available to treat their prostate if it's causing problems with how they're urinating. Well, luckily we now have a new treatment available. It's called a UroLift. It's a minimally invasive procedure where we put some stitches into the prostate, and I put the stitches through a scope that goes up the penis. It takes less than 10 minutes, to put these stitches in, and once that's done, they don't need the medications. And it's really revolutionized.
At all? I mean, so
no,
this
they
kind of
don't
takes
need the
care of
medications at all.
And you were the first in the state to...
I was the first in this state of Arkansas to reach the Center of Excellence
Center of
designation
Excellence.
for the UroLift procedure.
Okay, wonderful. So Dr. O, I'm going to go back over to you. When we talk about healthy lifestyle, what are some basic things that all men can do to try to be as healthy as possible day to day?
Exercise. That's probably one of the biggest
You may not
things.
want to hear it, but exercise.
But exercise, any type of strenuous exercise. Some people think a lot of times that when we talk about exercise, we're talking about they have to do heavy lifting
Right.
or a lot of running. But literally 30 minutes a day actually would do the body a lot of justice. Just even the brisk walking or walking for 30 minutes a day would do them justice. So it's not whereas people give excuses of saying I can't work out. It's just if you just do a little bit of 30-minute walking, your heart will be happy with that, and it allows you to get up and not live a sedentary lifestyle, pretty much. So
You do it with your wife or kids too.
Yes,
Take the dog for a walk.
and that's it. I mean, if you have kids, there should be no excuse, because now with everything that's going on with COVID, I mean, you have all day in the world to actually just get out and actually go walk. And so that's one of the biggest things is walking and exercising. Other than that, just eating healthy.
Okay.
And eating healthy doesn't require that you have to be diet. It's just moderation and picking what you choose to eat and put in your body, because that's another thing that people don't understand. So diet is probably one of the biggest things where it's can lead to somebody being diabetic or not being diabetic, depending on how they eat and what they eat and put in their body. So a lot of times just on moderation of, instead of eating 2 hamburgers or a full hamburger, you can cut it down to half or one. And so that's another big thing. Just moderation is another thing.
You're really taking away the extremes there. You don't have to go to a gym every day.
No.
You don't have to be on some crazy diet.
No.
It's just moderation.
Moderation is about
walking.
And so that's the biggest thing.
Okay, we're taking away the excuses today. So no excuses for not getting some exercise and just eating in a healthy moderation type way.
And I would also add that a lot of men avoid this, but mental health is a big thing.
So good.
A lot of men try to avoid and think that we're all macho and that we don't have we don't talk about mental health because we don't like to open up a lot of times. But mental health can actually add a little bit to reduce your stress and reduce things like cardiovascular disease or hypertension, which can actually get elevated with increased stress.
So you can't really do one, you have to do all of them, and it's so important to do all of them.
Yes.
So great advice. Dr. Lay, we were talking about this a little bit ago, but what are ways that specialists like yourself and family practice doctors really work together when it comes to men's health?
Well, you see, you're not just a prostate and you're not just a genital organ, which is what I deal with. You know, the rest of the body supplies these organs with blood and nutrients, and that's where Dr. Onyenekwe's expertise comes in. A lot of times, for example, I'll see men, they complain that they have to urinate very frequently, and then I'll work them up and I'll find that they actually have uncontrolled diabetes. And then that's really Dr. Onyenekwe's territory to be
Hand them
fixing.
off.
Right. And as he was mentioning with mental health, some men will come and say, well, they have trouble with erections in their sex life. But then when I work it up, it turns out that they're depressed, you know, or they may have low testosterone or something else going on, and that's why their sex life is not what they want it to be. And it's not just a matter of handing out pills. I mean, we can easily hand out pills, but there's often something else underlying the problem. And to go through the issue of erectile dysfunction, that's where I and the family practitioners work together hand in hand. Because an erection is really just blood going into the penis under pressure. And for that to work, there has to be enough blood coming in under pressure. If your pipes, the arteries, aren't delivering that blood because the pipes are narrowed or they're clogged with cholesterol, then erectile dysfunction can often be an early warning signal that they may have trouble with their heart or stroke risk in the future. And the same things that cause heart and stroke risk can cause erectile dysfunction. So we really are treating a cardiovascular problem when we have erectile dysfunction. So all the same things, smoking, you know, high cholesterol, high blood pressure, diabetes, all these things, they go into erectile dysfunction.
It's all interconnected.
Right, so when
It's
somebody
interconnected.
comes to me, especially if they're young, and they have erectile dysfunction, then they need to see Dr. Onyenekwe because there's something deeper
Something
going
else.
on.
Very good. Okay,
Right.
so you've given us some good advice on what we should be doing. As a doctor, how do you encourage men to try to lead these healthy lifestyles? What's your secret?
I guess pretty much talking to them and just giving them advice. And I guess I don't try to sugarcoat things. I try to tell them exactly, well, this is how your life is now, and then I give them a picture of how their life will be probably 5 years from now or
That's
10 years from now, and tell them that if things are not corrected, this is the way that they're leading. And that's just not based off of just what I think, but that's based off of just medical expertise and what we've seen throughout the years of certain lifestyles of how it will lead to. If you continue smoking, later down the line, not only will you have bad veins that can lead to cardiovascular problems, having hypertension, having increased stroke rate, it also may cause you to have lung cancer and other problems and erectile dysfunction, like you were saying. So it's a lot of things, whereas I just tell them, okay, this is how you are now. You feel like you're healthy and nothing's wrong, but 5 years from now, this is where
What
we're
you'll be
going to
looking
be.
at.
Yes, so I think that helps them, give them a bigger picture and a better picture of exactly what's going on and exactly how I'm trying to help them fix it.
And if somebody wants to get in touch with you or get more information, how can they find you?
Well, I'm here at Celine, and I'm sure we'll have a telephone
Yes.
number posted for both Dr. Onyenekwe and myself, and call us, and we'll be happy to see you.
Get you. Very good. And how about you?
Same thing, and just find me at Central Arkansas Family Practice, and you can look us on Facebook or look us on the internet, and you'll be able to definitely find us, and you can contact us anytime. I'm taking all insurances. So.
Very good. Very important. Well, thank you guys so much
Thank
for
you.
sharing your knowledge today. It's good, such good information. We really want to keep everybody healthy, and right now we're really focusing on that men's health. So hopefully we said something here today that can help you out and keep you all very healthy. Well, thank you so much for joining us.
Thank you for
Thank you.
asking us.
Hope you have a great day.